I became a consultant in my specialty partly because of interest in the disease. I managed a lot of patients who have colorectal cancers, inflammatory bowel disease, and looking after these patients made me enthusiastic about the management of the condition, especially when it came to all the various different technologies, innovation, and how I could utilize that in managing these patients. About 10 years ago, we started doing a lot more minimal invasive surgery within the UK. We were a little bit behind the rest of the world, but we've pretty much caught up. We now have robotic technologies in place. Robotic technologies are pretty much advanced minimal invasive surgery. So in the pelvis where I do most of my work, when you've got a narrow confined space, having a device that allows you to work in a very articulate way with a device that has pretty much the same movement as a hand allows you to do minute, specific, particular procedures which will be much difficult in another way. The first thing I do with any new patient is to welcome them and make them feel as comfortable as they can be. My specialty is perhaps a specialty where people have a lot of reservations about being descriptive about their symptoms. I mean, who wants to talk about rectal bleeding and constipation? So the most important thing is to make them comfortable, let them feel that it's just you and them, be passionate, open-minded, make them feel that you're listening to every minute detail, which might be so significant to them. And I think the most important thing after that consultation is summarizing what we've discussed so they feel that actually you have been listening, and then coming up with a management plan together which they feel that is workable, and they have the confidence when they leave that there is something, they feel that they've achieved something by coming to see you.